You dangled a carrot to Victorians, and today it kind of feels like you've hit us with the stick.
Health Minister Greg Hunt says the only reason you would hold off reopening is you don't have confidence in your contact tracing. Is that true?
No, that's wrong. Completely wrong. As I've just said to you about 50 times, there are 1,000 swabs plus in the laboratory, and we don't have the results for those yet. And once we do get those results, we'll be in a better position. We'll have a clearer picture to be able to make announcements.
New South Wales has been open for months with daily average cases of more than 10. They've dealt with outbreak after outbreak. If our contact tracing system is as good as theirs, if we have as much faith in the Victorian community as the New South Wales government has in their community, why can't we reopen?
Well, I don't accept the conclusions you're drawing at all. There's no question about faith in community. There's no question about the work that hundreds of public health professionals are doing right now, and community leaders and people in schools. They're all working very, very hard. This is a pause, nothing more than that.
On to say that it's paralysis in decision making. What would you like to say?
I've got nothing to say about those comments, nothing whatsoever.
Why is that?
I think I've answered your question.
She's been a respected member of your government.
I've got nothing to say about those comments, Rachel.
Why
nothing,
not?
because I have nothing to say about them. That's a choice I'm making.
So
And I'm not going to sit here and be interrogated about why I'm not commenting on something. That doesn't make any sense at all.
The target was an average of less than 5 cases. We're there now. Did you mislead Victorians?
No, I did not.
Can you understand that some feel that you did?
Sorry, keep saying you can't link these cases. But is it awkward for you to make that decision when we have the former health minister that's saying that we should be opening? We've got the New South Wales Premier, the health minister saying that we should be opening over there, the federal health minister, and also the PM, and also the WHO saying that we should be open. Is it awkward?
So amongst that list of individuals and organisations, none of them are in the tent. With all of the data that we have, with all of the understanding that we have of each and every case, who their close contacts are, how they're linked, the specific complexities with each and every household. Our team's aware of that. They are of a united view that this is, as frustrating as it is, that this is an appropriate 24-hour period to go through.
What else is in the tent that we don't know about?
There is a whole bunch of data that we are sharing with you every day. The cases, the close contacts, the secondary contacts, we're sharing all of that. We can't tell everyone's individual story. That would be a breach of confidence. But we know that there are complexities, and we know that there are some households that are not yet linked. We're being upfront about that, and we are being upfront about the fact that this broader testing is to try and find those additional links, and we will have the answer, and we will be broadcasting it tomorrow and the next day.
Why are you saying we're still on track when we've reached our target to reopen?
So we're on track in terms of the average daily cases. The mystery cases is still above the target that was in the initial roadmap. We haven't hit that, but I think we're on track to hit that. I think we'll hit that in the next few days. And as I've said this week, I'm not so concerned. There are a few of those mystery cases that I think are unlikely to be true cases, and there are a number of mystery cases that are dropping off in the next couple of days.
Where else have we gone wrong in Melbourne? Why is it in Victoria that we've been in lockdown for such a long time, the longest in the world? We're at the targets you've set out and we just still can't reopen. What have we done wrong?
Well, so our lockdown hasn't been the longest in the world. There are a dozen or more countries that have had longer lockdowns. There are many, many countries that have had stricter lockdowns, and there are some countries that have had longer and stricter lockdowns. So we're not by any means the longest in the world, and we've gone through a period of opening recently. We're also going in a direction that very few countries in the world are going through right now, and so we have to have gone through this to get to the low case numbers to ensure the long-term success. The successes, and the Czech Republic was lauded. They had a celebration, I think, in the middle of Prague to say we've beaten coronavirus. They now have the highest case numbers and death numbers per capita in the world.
To suppress coronavirus.
Correct. All I'm saying is that there's been complacency in places in the world where they've thought it's been beaten. We are moving to a point where we're not just beating it, but we're keeping it beaten into the long term.
Premier, why didn't you just say that an hour ago?
Well,
As directly as that.
James, I'm sorry if I've not been as clear as I try to be. It was a very long night and a very early morning, and I've been trying to find an opportunity to come back to the podium because your question indicated to me that perhaps I had not been as clear as I should have been.
I don't mean to be.
No, that's fine.
But-
I'm not
People are really
trying to be anything else other than clear. And if I was not 100% clear, then I'll try to be now. We have to wait for these test results. And in the next couple of days, which I think I made that point, we will have more to say. We'll be able to make announcements. We are still on track for the 1st, and we may even be able to begin the process of opening up earlier than then. Wednesday, Thursday, Friday. That is our aim. But we can't announce today and presuppose what the results of these tests are, because they're in the labs. They're literally at the labs now. And there'll be a bunch more that'll get, the samples will be taken today. They'll go to the laboratories today, and we won't get them back probably to late Monday.
You've spoken about 24 to 48 hours. Can we expect an announcement by Tuesday at the latest?
I certainly want to be able to do that, yes.
How can Victorians have faith that you're weighing up their jobs, their livelihoods, and their mental health that is so many people are suffering because of this long lockdown? They're just so desperate to get back into work. How can Victorians have confidence that you're weighing up all of these impacts and the hurt that the lockdown has caused with how you're managing the virus?
All of those things are relevant, and all of those things can be appropriately dealt with once you've got the health issue dealt with. We can only open this week, and the debate is about what day this week we do it, pending the results. We can only open because we have driven these numbers down, and that we then can have confidence that we can keep the virus suppressed, and we can find that COVID normal and lock it in and be able to defend it throughout the course of 2021. It may be many months before we can go back to normal. It's COVID normal that we have to find, and that's exactly what we're determined to do.
Why can't we have those details? We've had weeks of very low case numbers and we still don't seem to be able to get specific details on the very low cases.
We provide as much information as we can without identifying people, and Rachel, this is exactly the point. The smaller the numbers get, the more likely you are to be identifying people. That's the absolute thing. It's the same principle that, for instance, in a very small country town, if there's one case and we say too much about that one person, then everybody in the town will know.
Surely
So
you
as the
could
numbers
say-
get smaller, even small details can identify the person. Where we can do that, we have as much data out there, as much information as possible. Always happy to try and do that, but we do have to just be careful that we're not identifying somebody.
As long as we're living with this virus, there's always going to be outbreaks. We're always going to be having to wait for thousands of test results to come back.
Yes.
So why can't you reopen us now?
Well, I think we've dealt with that matter 5 different ways. We're waiting for test results. We have an outbreak. We don't know whether it's contained, because until we get the test results, we can't know whether there are linkages between those cases. And we're not open now, you see. So we have a unique opportunity, a very rare opportunity, to be able to deal with this outbreak and deal with it properly, and then open up knowing the enemy we're facing, rather than having a whole lot of unknowns in a part of Melbourne where there may well be much more virus than we think. It's just about waiting to see those test results, and I think that's the most appropriate thing for us to do.
Why has it taken so long, though? Why are we still at this point, where at the end of October, that we don't have confidence in our contact tracing system?
But see, that's no. That's not a question. That's a statement, and it's wrong. It's not a fact. It is wrong. It is absolutely wrong. We would not have found the 11 houses in households in very quick time. We would not have people isolated by the hundreds in their homes, and we would not be reporting cases in the 30s for this outbreak. It'd be in the hundreds. So that criticism is neither factual or fair on the thousands of people who are out there working their guts out to pull this thing up.
My question was why is it taking so long? I suppose we've just been
Well,
in
I'm not
lockdown
sure that
for
there was a
3.5
question there.
months.
There was a statement which is basically calling into question the work that thousands of dedicated people are doing, and I'm not letting that slide through. Why has it taken so long? This thing moves rapidly. It's wildly infectious. These are the circumstances that we've had to confront for weeks and months. Victorians have done an amazing job. Today's not the day to do a series of detailed announcements about opening up. That day will come very soon. We just have to wait to see these results.
was the point of the roadmap? We all spent so much time on it, going through dates. A lot of businesses were figuring out what they would do, trying to stick to it, taking bookings. What was the point of it, seeing as we're not sticking to it?
Well, I don't accept that, again, another statement that is just not right. We've got a roadmap. People wanted a plan. A plan is important. We're all working towards that plan. I had hoped to be able to make announcements today that would have come into effect midweek. We may be able to hit that target anyway, just not today. We have to wait and see those test results come back.
I guess these questions aren't just personal, they're what we're reading online from the community.
That's
and how
fine.
they're
I don't mind if
feeling.
they're questions. It's when they're statements that are just not factual that I feel the need to make that point.
My question was, what was the point of the roadmap? It wasn't a statement.
Well, I don't know that I've got enough time to be detailing why the roadmap was important. I think everyone knows why the roadmap was important. I don't know why. I don't know where that question would come from. A plan and targets and working towards meeting them has always been important, always. And I would have thought.
What was the point
obvious.
of having a roadmap that we weren't going to stick to?
Well, but I'd say that I've made the point maybe hundreds and hundreds of times. Nothing can be guaranteed with this. There are dates, there are targets, and they're just that. They're targets. They're not a guarantee. They're about where we hope to be at a given point in time.
Lord Mayor
And many of those we have been able to meet. So again, I'll leave others to judge whether a roadmap and a plan is important. I tend to believe it is.